Good afternoon, students. You're most welcome. This is Sister Safinah taking you through NG tube insertion. As we are looking at NG tube, this is a patient who is unable to feed, so you have to pass the tube so that the patient can easily feed well. So an NG tube insertion, it is a clean procedure, and so we require a tray, which is a clean tray. This is our tray, and on a tray, we shall need a gallipot containing the NG tube itself. We shall need a gallipot containing water. We shall need a vomitus bowel, that's in case the patient feels like vomiting. We shall need a receiver. This is for the used gloves after doing the procedure. We shall need a gallipot containing gauze swabs to clean the nostrils. We shall need a receiver containing litmus paper. This will help us to confirm if the tube is in situ. We shall need a pair of clean gloves, it being a clean procedure. We shall need a stethoscope. This is another of confirming if the stomach tube, if the NG tube is in situ. We shall need KY jelly to lubricate our tube for easy passage. We shall need a feeding syringe or a 60 ml syringe. This is to help us rinse the tube and as well feed the patient. We shall need a 20 ml syringe. This 20 ml syringe will help us to aspirate the stomach content and confirm or test if we are in the stomach. We shall need a glass of clean water. This will help us to rinse the tube. We shall need a Macintosh and a towel to protect the patient's linen or the patient's clothing as we are passing the tube. So at the bedside, we shall need an apron to protect ourselves as we are doing the procedure. We shall need a hand washing facility for cleaning our hands. And then I will need an assistant to help me carry out the procedure because it is not a two nurses procedure. So before doing the procedure, we have to ask for consent from the patient. This is Mr. Mulago. Good afternoon, Mr. Mulago. I'm Nurse Safinah from Mulago School of Nursing and Midwifery. I would like to pass a tube so that you can be able to feed very well. Am I allowed? Requesting for your cooperation. Thank you so much. Assistant, kindly help me. We do wash the hands. Assistant, kindly put on the apron. So when we are passing an NG tube, the patient should be in a sitting up position. And if the patient is unable, we elevate the head of the bed to at least 45 degrees. Mr. Mulago, hope you're fine. Help me, we turn the bed, expose the patient's chest. We have to protect the patients. We put it here, the chest. So I have to inspect the patient's nostrils to confirm if the nostrils are patent. Mr. Mulago, allow me check. Both nostrils are patent. Then I'll need to clean the one I'm interested in. We clean once and discard. I'll have to take measurements. As the measuring starts from the tip of the nose behind the ear lobe to Dazinfide process. Where it ends, you have to make sure you label it very well. Hope means a lubricant. How to lubricate the tube to ease the passage. Mr. Mulago, don't worry. Kindly swallow in between breath. Swallow. Swallow. You make sure the tube enters to the tip you had labeled. It's here. Before doing anything, you have to check in the mouth. Kindly open your mouth to see if there is any coiling in the mouth. There is nothing. So before we secure this tube, kindly help me hold here. We have to confirm if the tube is in stomach. We are having 3 ways of confirming. One, we can use water. When we see there are bubbles, then that means we're in the airway. No bubbles seen. So this indicates we're in the right C2. Or we can aspirate the stomach content. Then we have to check using the litmus paper. If the blue litmus paper changes to red, then we shall be in the stomach because it is acidic. Yes, it has turned red. And then the last way of confirming, assistant, kindly help me hold the stethoscope. You're going to put it on the stomach and then I push in air. You put on the stethoscope and then you confirm. The moment you feel the bowel sound, then we shall know we are in the stomach. Have you felt it? Yeah, thank you so much. Then we put our spigot. Help me get me some strapping to secure the tube. Mr. Mulago, hope you're fine. Don't worry, all will be well. Thank you so much. So we have to introduce their water to rinse our tube. So that we can avoid blockage. This is our water which you have to pour into the tube to rinse the tube. After pouring, you remove the tube and then close it using a spigot. Mr. Mulago, we are done. You'll be able to feed now so that you can improve on your health very well. Thank you so much for your cooperation. So after here, we have to document what we've done to Mr. Mulago. An NG tube has been passed by Nurse Safinah at 6 a.m. Thank you so much for being cooperative. Assistant, thank you so much. We can now wash our hands and clear away.